Hi students, we'll be discussing the recall questions of your NEET 2022. So I'll be discussing all the questions based on the recalls and the options. So I'll try to give all the references for your answers also. So the first question was on open vial policy. Healthcare worker planning for an outreach session receives two open pentavalent and open MR vaccine. One vial was MR, other was pentavalent. Which ones will you administer according to open vial policy? Means what she has to use, what should not be used. So you know this, pentavalent can be used in the next sessions, and we should not use MR because MR is diluted. So lyophilized vaccine, reconstituted vaccine should not be used in the next session. Open vial policy, we have covered this in your class vaccine updates. So what is open vial policy? I'm using the same slides used in your classes. Reuse of partially used vials for 4 weeks. So we have to mention date and time like this. For example, IPV, what I'm showing for you, date, time is mentioned. It can be used in the next session. So it is not applicable for BCG, measles, MR, JE, Rotavac and Covaxin and Covishield. It is not applicable for Covaxin and Covishield also. For all the remaining vials, it is applicable. So the question was pentavalent, yes, you can use it in the next session. MR, we should not use it in the next session. So it is applicable for penta, not applicable for MR. Second question, very important question. The life expectancy of Japanese on an average is 87 years because of early diagnosis and treatment of cervical cancer in females. That intervention has led to increase in 15 years of life expectancy with utility value of 0.8. So what measure can be calculated from this? So the question is having 3 keywords. Tell me good. One is intervention. Second is quantity of living, that is 15 years of life expectancy. Third is utility value. What is utility value? We have discussed in the classes. That will indicate quality of life. So QoLIS measure to include both quantity and quality. So we have discussed QoLIS under summary measures of public health. I am using the same slides from our classroom. We have discussed what is QoLIS, what is the use of QoLIS, like to say what is the effectiveness of the intervention, and I have also given the example saying treatment A versus treatment B, years lived, utility values was given. We have calculated such questions in our classes also. So good that they have asked this question on QoLIS. Again, if someone don't know about QoLIS in detail, I'll be discussing and using the same slides of my class. Quality adjusted life years. It is a measure to combine quantity and quality of life together. Quality of life, how we lived, is expressed by utility values. Utility value. For example, if I say one individual has lived for 1 year in perfect health. Perfect health utility value is 1. So quantity 1 year, quality 1 year, 1 QoLIS. What is 1 QoLI? 1 year of life lived in perfect health. This is 1 QoLI. Half QoLI ka matlab 1 year is the quantity, half of perfect health. So 0.5 is the utility, 0.5 QoLIS. Like that, just the basics of QoLIS. What is the use of QoLIS? We have discussed to compare how good is the intervention, or to say which intervention is better, or intervention A is giving how much of QoLIS, also known as utility analysis. Like for example, treatment A, years lived 4, utility value very good 0.9, total QoLIS 3.6. What about treatment B, years lived 2, utility value 0.5. So what is the QoLIS given by treatment B? 1. So which is better? A is better than B. But how much extra QoLIS you are getting? 2.6. So this is the detailed explanation of QoLIS for you, which was discussed in the classes, and the answer was QoLIS for that question. Come to the next question. The most logical and cost-effective strategy for control of urban rabies? It's a very good question. WHO says mass vaccination of dogs, and that was mentioned in the option. Eliminating street dogs and mass vaccination was the answer. So testing, no. Labs for diagnosis, no. Strengthening healthcare system is a vague option. So clear-cut, logical and cost-effective strategy for control of rabies is eliminating street dogs and vaccination. So we have covered this in your classes. As you can see in this slide, I have given this, the most cost-effective strategy for elimination is mass vaccination of dogs. That was mentioned in the option. So even in park, it is clearly given the logical and cost-effective approach is elimination of stray dogs and mass vaccination. As you can see here, that will be the answer. Good. Next question. So we have discussed this in your communicable disease, rickets cell infection. A soldier complaining of rash on body, sparing palms and soles. Very important clue was given, that is louse is the vector. Epidemic typhus is the answer, also known as louse-borne typhus. What is the agent of epidemic typhus? Rickettsia prowazaki. Other options you should know that can help in the future exams, like Akari, the vector is mite. The disease is rickettsial pox. Rickettsia typhi, the vector is flea. Disease is murine typhus. For Conori, it is tick. The disease is Indian tick typhus. So if they have framed question on epidemic typhus this time, there can be one more question like match it with vectors. That can be one more way of asking the same question. So epidemic typhus, louse-borne typhus, we have covered under rickettsial infection. Come to the next question. Very easy question, just because they have given everything for you. Person traveling to Africa, jaundice and hemorrhagic fever. So you are almost suspecting it as yellow fever. But one more important keyword, diagnosis was confirmed by the presence of Torres bodies, inclusion bodies related to yellow fever. So it's an integrated question. Even in microbiology, they'll discuss inclusion bodies. Keywords, tell me good, Africa, hemorrhagic fever, and confirmation by Torres bodies. What is the vaccine used for prevention? Answer is 17D strain, yellow fever vaccine. 17D is the answer. So yellow fever was discussed under vector-borne disease, 17D strain, and we have discussed international health regulations of yellow fever. So I'll be using the same slides telling yellow fever vaccine is live attenuated vaccine. 17D strain is used. Lyophilized vaccine providing lifelong immunity. Usually we say specifically the immunity is for 35 years. If 35 is not in the option, then you can mark it as lifelong immunity. What are the contraindications of yellow fever vaccine? Live attenuated vaccine. So one is HIV symptomatic and pregnancy. Pregnancy, it is routinely contraindicated but can be given to pregnant only in case of epidemics. HIV symptomatic is a contraindication, and allergy to egg protein, because egg is used for preparation, making culture of live attenuated vaccine. The side effect, very difficult question if they ask in the exam. It is vaccine associated visualotropic disease. Live vaccine causing symptoms similar to yellow fever, hepatic failure, vaccine associated visualotropic disease. One more update you should know, the question on vaccination certificate. Validity starts after 10 days, and once it is valid for lifelong. So I'm showing the same slide of my class. I'm showing the vaccination certificate for you. It is valid for lifelong now. No need to renew it every 10 years once. So this is one more thing you should know, which can be a question in the future. Asha prompted primary for institutional deliveries in urban area of Madhya Pradesh. So when they have mentioned Madhya Pradesh, that is a bit trickier for you in the exam. They have given two keywords, urban area and Madhya Pradesh. How much incentives mother and Asha will get according to Janani Suraksha Yojana? So I'll be showing the same slides again. Cash incentives in JSY. So how much cash is given for hospital delivery? See this slide. Good. rural area, urban area, LPS, HPS. ASHA worker, you have to remember properly. ASHA in urban area 400 rupees, rural area 600 rupees. The only thing which changes is for mother, LPS and HPS rural area, LPS urban, HPS urban. Now you will ask one more question. Is there anything for home delivery? Yes. 500 for BPL pregnants, nothing for ASHA. Once you know this background idea, now the question comes whether Madhya Pradesh is under low performing state or high performing state. See, listen, the question they have mentioned urban area. So answer has to be within this. The next thing what you should do is whether MP is LPS or HPS. So that is a bit difficult for undergraduate to remember, but still you should know. Fine, if they have asked the question, better to know this. There are 10 low performing states in India as of Janani Suraksha Yojana. For Janani Suraksha Yojana, based on the number of hospital delivery, there are 10 low performing states. 8, we call it as Empowerment Action Group states, EAG states. Empowerment Action Group states plus 2, Assam and Jammu Kashmir. What are these 8 EAG states? UP, Uttarakhand, Aspas, you can remember like this. MP, Chhattisgarh, together, good. Bihar, Jharkhand, together, good. Only thing you have to remember is Rajasthan and Odisha. Other than that, AJ, Assam and Jammu Kashmir, total 10 low performing states. But intentionally they have made this question a bit trickier by asking Madhya Pradesh. Directly they could have asked low performing state, but at their level they want you to remember and they want you to retain a bit difficult because this was a bit of memory based question. First you have to recall it as low performing state. Then we have to come and answer it as mother 1000 rupees, ASHA 400 rupees. But still, if I want to make a guess in the exam, how I will answer this question, listen. I'll check urban area. Okay, good. MP, a bit difficult for me to tell it as low performing state. Fine, good. Urban area, how much ASHA will get? 400 rupees. Then I will roll out these two options. The probability of getting the correct answer is increasing now. From now it has come to like from 25% it has come to 50% because I have to mark within these two options. Then you can take a guess. Then if you can rule out two options, it's always about taking a risk in the exam when everything is competitive. If the probability is 50%, take a risk. ASHA in urban area, it is 400 rupees. Either I have to mark C or D. The answer is option C. Hope it is clear how to get the answer. That is also important. So not just what is the right answer, but in the exam, if I am stuck in between, have some patience, read the keyword urban area. If I don't know whether it is low performing state, then make it clear that ASHA you know, rural area 600, urban area 400. Then come back to these two options. Then make one guess. Fine, if you get the correct answer, well and good. Come to the next question. Very easy question. Green color in triage is used for which set of disaster victims? So listen, it is for ambulatory patients. Highest priority is given for red, medium, yellow, green, black. If I am telling in the series options like we have discussed it in disaster management, red highest priority, yellow medium priority, green ambulatory patients they can walk, black moribund patients least priority. So tell me again, easiest question, but still I want you to repeat it. Red, yellow, green, black. A, B, C, D. Red, yellow, green, black. Answer is ambulatory patients. Good. The next question. The organization to supply manure and seeds for implementation of applied nutrition program in schools. So the question is direct on supply of infrastructure, manure and seeds. Applied nutrition program was very old program. Around 1960, 1965, they have started implementing it. What UNICEF is doing, along with FAO, Food and Agricultural Organization, with some help from WHO. Usually FAO and WHO will take part in training, but UNICEF is taking part in giving and providing infrastructure, manures and seeds. Usually in schools, what they will do, they will be given manures, seeds, grains, and even water facility. And school children, they will grow their vegetables, if possible fruits, and they will consume it so that it will improve the nutrition of a child. The main purpose was nutrition, and the question was mentioning applied nutrition program, schools, and the supply of manure and seeds. So that once you are having school gardens, this concept is school garden concept. Once you are having gardens in your schools, that will help in improving the sustainability, because not that you are outsourcing and getting vegetables from outside. Better grow your own vegetables and fruits. That will increase the sustainability in your school garden applied nutrition program. Very good. But still, the answer was UNICEF for this. How to get the answer if I don't know what is applied nutrition program? UNICEF, maybe we know, we have discussed in our classes also. The campaign what we have is Gobi Triple F campaign. ट्रिपल एफ के अंदर आएगा फूड सप्लीमेंट्स, फैमिली प्लानिंग एंड फीमेल एम्पावरमेंट. Food supplements, something related to nutrition. To make a rough guess, I am telling, you could have marked UNICEF. Some students have given UNDP as the answer. No. Clear-cut reference I am giving from Park. The question was directly taken from this. Just to make a guess related to school garden concept, that was the question. Better go for UNICEF, and the correct answer is UNICEF. Together, UNICEF and FAO, then UNICEF will play a major part of giving supplies. FAO will also assist in this program, but this is for children nutrition. Answer is UNICEF. Good. Come to the next question. Next question is on case control study. Many children from a community coming to hospital were diagnosed with ALL, leukemias, acute lymphoblastic leukemias. It was suspected due to chemical waste from factory release that is contaminated with drinking water. So hospital want to do a case control study to find the association between chemical and leukemia. So what is the way to select controls for this case control study? So always keep in mind, case control study, when we select cases, it is with disease. When you select controls, it is without disease. Classification of cases and controls is based on disease status, not based on exposure status. First we select case and control, then we take the history of exposure. How many are exposed in cases, how many are exposed in controls. That is how we do ED by BC odds ratio calculation. So answer is not based on exposure status, it is based on disease present or disease absent. So it is OPD children without any disease. Some students are telling, sir, I will select controls without exposure. First, we don't select controls based on exposure status. It is based on disease status. If I select all the controls without exposure, then when you take the history, exposure is 0 in controls. If exposure is 0 in controls, then when you do ED by BC, odds ratio will become infinite. Then every case control study, odds ratio should be infinite. That is not the way to do. It is always taking cases and controls. Then you check how many are exposed in cases, how many are exposed in controls. Make it 2 by 2 table. A by C in cases, B by D in controls. Then when you divide odds by odds, we get ED by BC odds ratio. So it was a bit trickier question, and the answer is without disease. Either you can select from communities or from hospitals. The ideal way is same community. If community was not in the option, if it was an hospital based case control study, you can also select controls from hospital OPDs like mild illness, conjunctivitis. Patients can also be taken as controls. Come to the next question. Cohort study was done between two population, one taking green tea, the other is not consuming that, exposed, non-exposed. The study was done to check the association with the development of diabetes. Incidence was measured. Risk ratio is 0.8. It is less than 1. What is the correct interpretation? So risk ratio, if it is less than 1, it is negative association protective factor. Green tea population has less risk of developing diabetes. Now the question will come, sir, can I comment on significance of association? See, this question was not on significance of association. This question was on type of association. Risk ratio is a point estimate. It can indicate type of association, positive or negative. You should know this. Again, I'm discussing this in detail because some students confuse this with significance of association. Always listen one. Association between exposure and outcome. There are two things to remember. Type of association, significance of association. Type of association is given by point estimate. Risk ratio for cohort study, odds ratio for case control study. So risk ratio was given in the question. It can comment on type of association. Less than 1, negative association, protective factor. Now the question will come, was p-value mentioned in the question? P-value, if it is given, then you can comment on significance. So now don't go into the next level. Don't think about significance of association because option was not anyway, they have never mentioned significant risk, significant less risk, significance is not mentioned in the option. So it is enough for me to comment on type of association. Based on the information, we can comment on type of association. It is negative association, protective factor. So the answer is B. If at all you say, no sir, I have seen this question, some small number of students, they are thinking like this. If the question was on significance, then we cannot comment anything because p-value is not given. Then your answer will be insufficient to comment. The data is not sufficient to comment on significance of association. But that is not mentioned in the question. So let's not go deep into this question. Direct answer, less than 1, negative association, protective factor. Now what I will do, I will change the question. Green tea population has statistically significant risk of developing diabetes, has less risk, and the statistical significance was mentioned. If I say the question like that, if I include the word statistical significance, then risk ratio will not comment on statistical significance. Then you can say the data is insufficient for conclusion because p-value is not mentioned, because confidence estimate is not mentioned. Only when the options comment on statistical significance, then you can think like that and mark option D. Got my point? If the question is on risk ratio, point estimate is given, better you have to comment on type of association rather than thinking too much. If the examiner is not thinking about significance, better you should not think about significance of association. It was clear cut. If I say it was on type of association, then you can mark the answer as option B. If the same question was an INICET question, INICET paper, they are more fond of statistical significance. They will make a question on p-value and confidence estimate, and they will twist the question by asking, is there an inference to comment on statistical significance? Then you can say, no sir, it is insufficient for conclusion. Now better keep the question at this level, don't go to the next level. What my point? Good. Answer is option B. Come to the next question. According to biomedical waste rules, broken vaccine vials will go in which bag? Blue container. Discarded broken glass, it is in blue. So we have discussed this in your classes. Broken or discarded glass, including medicine vials and ampules, except contaminated with cytotoxic waste, it will go in blue. Glass and metals will go in blue. Some students, what they made, and the question was saying, sir, it was mentioned blue puncture proof container. Then blue is not puncture proof container, blue is cardboard box. If it was blue puncture proof container, then there is no answer for this question. Yellow, no. Red, no. Sharps, no, don't mark sharps. And blue puncture proof container, then blue is not puncture proof container. Then you'll think like this, then what to mark? There is nothing to mark then. So again, I'm telling better to be on the safer side. Let's take it like this based on the color. Broken glass, better to mark it blue, and the answer is blue according to me. Come to the next question. Which of the following is true for establishing an urban CHC? So it is based on urban healthcare. So I'll be telling what are the criteria for urban CHCs. So listen, urban CHC will act as a referral unit for urban healthcare. Urban CHC for a population of 2.5 lakh. 2.5 lakh. Okay, good. It is a referral center for 4 to 5 urban PHCs. 4 to 5 urban PHCs. So now come back to option A. 1 to 1.5, no. 2.5 lakh. 3 PHCs, no. It is 4 to 5 PHCs. Then the answer has to be in the remaining option C and D. Read this line. The facilities would be in addition to the existing facilities to cater the urban population in the locality. So what will happen in metro cities? Also, you can establish urban CHCs. In metro cities, the population will be more than 5 lakh. Then also you can establish urban CHCs. There they already have sub-district hospital or district hospital. This is an additional to that. Not that if there is no district hospital, we have to establish. No, wrong answer. Already there is district hospital. Already there is sub-district hospital. Fine. This is an addition to that. Now the answer is for metro cities, urban CHCs can be established for every 5 lakh population with 100 beds. For other areas, it is 30 to 50 bedded facility if it is 2.5 lakh. Here you are doubling the number of beds because almost the population is doubling. Got my point? So metro cities, it is 100 bedded facility. Answer is option C, correct. A bit difficult question, I'm telling, not that easy. Because most of the students, what they will think, if there is no sub-district hospital, this will be the replacement for that. And most of them, they are marked like that. But still the trick was in this. A bit difficult question. 100 bedded facility for metropolitan areas. So repeat, population 2.5 lakh, referral center for 4 to 5 urban PHCs, correct option C. Option D, even if there is district or sub-district hospital, you can, this is an addition, this is an additional facility you can give for urban healthcare. The next question, again a bit trickier question. All of the following are risk factors assessed in STEPS approach except. So listen to my question now. What is STEPS approach? We have discussed in the classes. There are 3 steps in this. Questionnaire for assessing risk factors, that is behavioral risk factors, physical measurements, and also biochemical measurement. So 3 steps. Risk factor assessment using a questionnaire, physical measurements, and biochemical measurement. But now again, listen. Questionnaire has behavioral or risk factors related to the individual. Step 2 is physical measurements. Step 3 is biochemical measurements using blood samples. Now when you come back to the option, you'll be searching where is the answer, because behavioral, yes, it is included. Physical, yes, it is included. Now the answer has to be within B and D. If I want to mark both are wrong, yes, you can take it. But if I want one answer, no. No, sir. Since the question is all except, I want one answer. So, fine, good. When I discussed with other faculties, what they told, sir, behavior can also be labeled as psychological factors. Correct. Even I agree on that. Can also be labeled as psychological factors, stress, alcohol, etc. Just to rule out the option I'm telling, A, B, C, then there is no therapeutic component, because STEPS approach is assessing risk factors. It's a surveillance method to assess risk factors in the community. It is not going to the next level. It is not about treatment. It is not about treatment. It has no role in therapeutic, means it has no data on therapeutic component. So just still, if I want to mark one answer, again the students will ask, sir, tell me one answer, because both are wrong. Even I know both are wrong, but tell me one answer. Behavioral correct, physical correct. We will take psychological also has correct, because behavior and psychology, they almost match with each other. If I want you to, or if I want me to answer, the answer is therapeutic. Option D. Okay, there is an argument again, but still the answer is option D from my side. I'm telling you. Come to the next question. In high seismic zone prone for earthquakes, as a part of disaster preparedness, what will be done by medical officer at primary health center level? So listen, the question is on disaster preparedness. Organize simulation exercises, correct. Public education programs, correct. Secure funding and necessary requirements in case of mobilization of resources, correct. Why I'm telling all this correct? Because the question was directly taken from Park. See this. What has to be done during disaster preparedness? Where are the options? Like, yes, develop public education programs, correct. Organize disaster simulation exercises and check their response, correct. Adopt measures to ensure that financial and other resources are available and that is mobilized for disaster situation, correct. As you can see here, exact words what they have framed. Develop public education programs, organize simulation exercises and check their response, adopt measures to mobilize the resources including finance. So this is for manager, this is for management purpose. It can be a medical officer also, because medical officer is at the position of managing his own locality. But what option 1 says, follow instructions on radio and loudspeaker, it is not for the manager, it is for the general public. Even in Park it is mentioned, it is for everyone, general public. They have to follow instructions, whatever is given on radio, that can help in their response also. Since the question is at management level, disaster preparedness 2, 3, 4 correct. And the question was multiple correct options. Students have recalled it properly and they have said, like, sir, it was not 1, 2, 3, 4. Either it is 1, 2, 3, 1, 2, 4, like that. Good. And they have recalled it properly. And the way they have recalled is matching with this reference, what I'm showing for you, direct from Park. So answer is 2, 3, 4. Okay, come to the next question. A few other questions which can integrate with other subjects also, like pediatrics. Which of the following is true for criteria of high risk infant? So direct from Park, which of the following is true for criteria of high risk infant? Again, they'll discuss this in pediatrics also. Working mother, correct. Birth weight less than 2.5 kg, correct. Artificial feeding, correct. Birth order 3 or more, no, it is 5 or more. So this is the criteria for high risk infant and they have made it multiple correct option. So weight less than 2.5 twins, order 5 and more, that is the answer. It is 3 wrong. Artificial feeding, weight below 70% of the expected standard, failure to gain weight during 3 successive months with PM and area, and also working mother or single parent. So working mother correct. Second option correct. Artificial feeding, yes, it is mentioned correct. Answer is 1, 2, 4. A patient on anti-tubercular therapy complains of diarrhea and tingling sensation in the feet. So many times this question can merge with biochemistry, pharmacology, and even in PSM we taught this. It is peripheral neuropathy, pyridoxine deficiency due to isoniazid. So the question was on B6 deficiency, peripheral neuropathy due to isoniazid. So patient is on INH treatment. What supplementation is given? B6 supplementation. That is one more question which can be framed on this. So the image was shown for you. What is this due to which deficiency? So beta spot due to vitamin A deficiency. Again, this will merge with ophthalmology also. MDR TB definition, again in respiratory medicine they will discuss this. Answer is resistance for INH and rifampicin to drugs. If I add fluoroquinolones, that will become pre-XDR, that is before pre-XDR. Option D with one injectable addition, that is the older definition of XDR. The newer definition is different. This is the older definition of XDR. The newer definition says INH, rifampicin, fluoroquinolones plus one group A drug, either bedaquiline or linezolid or both. So this has been replaced by group A drug. So what they have given, this option D is older definition of XDR. So fine, repeat with me. Option B MDR, option C pre-XDR, option D is older definition of XDR. One more question on outcome of tuberculosis. A TB patient on treatment had completed both intensive phase and continuation phase. When you did sputum, it was negative both after intensive and continuation phase. Negative, negative. Okay, fine. What is the status of the patient as per the guidelines? Options was like this: non-compliant, completed, lost to follow-up. Answer is cure. Why not completed? Some students they say, sir, what is the definition of treatment completed? Cure means patient was sputum negative after intensive phase and after the completion of treatment. Both samples negative. But if the patient was negative after intensive phase, but once finishing the treatment, the results are not available. The second time sample, the results are not available. Then you can label the patient as treatment completed. So what is cure? Negative, negative. That is cure. What is completed? Negative, but the second result is not available. The last question, one more a bit of controversial question, because a 12-week primary is visiting for antenatal checkup. Correct advice regarding extra calorie requirement. The older guidelines says 300 kilocalories, but the newer guidelines, as we have discussed in the classes, it is 350 kilocalorie throughout pregnancy. Now we don't have trimester wise classification, so it is 350 kilocalories in all the trimester. But still, if you want me to answer one out of this, as per the older guidelines, I can mark 300 kilocalories throughout the pregnancy. Some students say that, sir, it was 350 throughout pregnancy, so 300 was almost near to that. I have marked this. Fine, if you have marked 300 kilocalories throughout pregnancy, almost correct as per the recent RDA guidelines. So we follow RDA guidelines for nutrition, even in pregnancy and lactation. So what is for pregnancy? Add 350 in all the trimesters, lactation plus 600 plus 520. First 6 months, next 6 months. So yes, good. So again, there were two more questions on IUDs, which will be discussed in our gynae. What is the contraindication of copperty? And one more question on irregular bleeding. What is the best choice of contraceptives? So the discussion was in a rapid mode, giving the references for all the questions. We have tried our best to get the possible recall from all the students. Thanks for all your inputs. And from our side, we have decided and we have given our answers by giving the proper references, mostly from all the standard textbooks. So hope this discussion related to question, options and the answer match with what you want. So yes, sir, I've come across your discussion. I've seen all the answers. Some could not, I could not make it, I could not mark it correct. So don't worry too much about this now. You have finished your exams. You have done very good. You have done all your efforts into one exam for 1 year. NEET is very important. Some says the exam was very easy. Some students they say it was too tough. Some say, sir, it is more of an average pattern. That is what the role of normal distribution is. So finally, everywhere, usually in NEET, keeping in mind the whole number of students they are giving the exam, there is a concept called as regression to mean. If there is huge sample size, when the scoring, when they give, it is almost averaging out. So don't think too much, don't think about buzzing what has happened. Exam was not that easy, exam was not that tough. Always NEET exams will be on an average level, giving opportunity for every student. So fine, good. I'll give the PDF also. It will be uploaded in your app again. The same discussion PDF which I've used this for your discussion. So fine, take care. Thank you so much.